Welcome to Living Chronic, the podcast that explores the realities of living with chronic illness and disability while redefining how we thrive in our personal and professional lives. I'm your host, Brandy Schantz, a disabled veteran and chronic illness warrior, here to discuss the challenges, triumphs, and untapped potential of life with a chronic condition. Before we dive in, please take a minute to hit the subscribe button on whatever platform you're listening. Now, let's change the way we think about disability together. Hi, you're listening to Living Chronic. This is Brandy Schantz, and I'm here today with Glennae Davis, registered nurse, author, and equity advocate. So, welcome, Glennae.
Thank you so much, Brandy, for having me.
So, thank you so much for being on the podcast. I really love the conversations we've had, and I love what you're doing. You're a registered nurse, 20 years as a nurse. You've been in health equity for 10 years, and you've done a lot of work regarding not just health equity, which is a really important topic and very timely, but also burnout, which I can't think of a more timely topic in healthcare. So tell me a little bit about your story and how did you start talking about this before we ever really understood how important it was?
Correct. Well, thank you for asking, and thank you for having me here on the Living Chronic podcast. It is an honor to be sitting here talking to you and giving this information to your audience about living chronic, whether it's in chronic pain or chronic disease management for women. I'm a registered nurse, and so I'll be speaking from a registered nurse, Black woman perspective in the healthcare field, and having an injury, something as simple as tendonitis that just took forever to heal, which most musculoskeletal diseases do. And I just could not move forward in my life or at work. It's just the pain overtook me. And as a registered nurse, I was going into the workers' comp industry. Then I was, sent over into sports medicine. And nobody really wanted to give me the least invasive treatment first. It was like, take this pill, this is your diagnosis. And some of the pills were highly addictive, like opioids. And the doctor blatantly said to me, well, if you don't want to take the opioid, you must not be in pain. Pardon me,
Oh,
sir?
wow.
Pardon me? Like, how do I or anyone else who gets addicted to pain opioids return to work?
Right.
So over the 4 years of going through this hectic system called the medical system and the profit before people, I realized that this must be the gap in healthcare where so many people fall victim to America's public health crises. And I said, God, if I get through this, I promise I am going to be a praxis in the middle of this. I promise that I'm going to close this gap. So I would like to talk about the three main employment health issues that make working with chronic diseases like tendonitis or fibromyalgia or whatever may be unique to you, and provide a solution for people who may be facing workplace discrimination or fearful about that, or leery of taking medication, wondering whether or not this medication works for this situation. Because as you know, Brandy, chronic diseases are very complex.
Mm-hmm.
And we, as patients, don't always have the vocabulary to even articulate what it is that we're experiencing. And then you go in
Mm-hmm.
with this just symptoms that you're experiencing, but you don't really appreciate where the symptoms are coming from. And so helping women get accommodated to continue working in gainful employment, preventing poverty in nurses and Black career women who may be facing these issues in the workplace.
In your experience is so common, and I think there's this. We could write an entire book just on the things you learn as a chronically ill person versus a healthy person that just probably doesn't know, how these things transpire. I've gone through the same thing. So have so many other people who've come on the show who are listening. You go into the doctor, you're having so many issues, and what you're really looking for is a way to live life. That's your goal. I want to live my life again. What does that look like? Do I need accommodations to live that life? Do I need to change something to live that life? What is it that it takes to live my life? And so many of us are first just offered this cocktail of drugs that will stop you from living your life. Yeah, sure, it will mute the pain. That we do achieve that. But now I'm in bed all the time, sleeping or unable to move or fatigued or one of the things that I'm always very concerned about as I'm looking at all these different medications is I can't really live because I can't even tell the difference between my body saying to me something's wrong, which is what pain is, or the side effects of the medications. And often we just don't want to push back and say, well, if that's what it takes, I guess this means that that's it for me. And let me start trying to fill out my application for disability. Whereas there really are other options. And we need to really open up those conversations around, hey, these 15 different medications, and that's not an exaggeration. I know so many people on 15 different medications are going to stop your pain, but they're going to put you in bed, or they're addictive and you won't be able to get to work. And we've got to find that middle ground. And that's what you've really been putting a good focus on.
Yes, yes. So, what do we need to get back to living our life after having these issues that kind of taken us and derailed us off of our normal
Hmm.
everyday living? And so, the first thing I like to tell women is that you have to speak up, and speaking up in the workplace can bring a retaliation to you because let's look at your company and industries as a whole. Once you fall out of the standard population, no matter who you are, you can be black, white, red, or yellow, you are now targeted. Your company knows how to handle the 99% who's keeping up with production. Everything is going along the ideal way of moving the company forward and bringing in revenue. But here you are in pain and needing something. Like, who are
Hmm.
you? And why am I supposed to stop my company and my production for little old you? Because little old you is important. Okay. You
Hmm.
are important. The one is valuable and important. And then you start needing things like access to workers' place rights and workers' compensation and FMLA. And those things cost the company money. So we want to help women learn how to speak up and be okay with, how can I put it? Be okay with them not understanding what it is that you need and what you want from them. And all that you want
Hmm.
is access to your workplace rights. We have state, federal workplace
Yeah.
rights, right? Because when we
Yep.
don't speak up, then you put yourself in a situation where your behaviors start to come out as performance standards because you're keeping these things bottled up inside, and then you are getting written up, and then absenteeism, which is taking off work and calling in because you just can't make your way to work this day. And then also this
Right.
thing called presenteeism, where you go and you show up but you just are probably, let's take nurses for example, are in so much pain, you're not turning to patients every two
Hmm.
hours as you're supposed to, or you're skipping medications and just charting that you did it because you just can't prime that IV pump. So now life, not just your life, but other people's life who is entreated trust to you are at risk. And then
Hmm.
you spoke about taking the cortisones and everything. Our cortisols, when they are spiked for stress issues, it's for us to make one or two decisions, and that is to take flight or to run. Most of us freeze because we do not know how to handle this type of controversy and conflict within the workplace.
Hmm.
And so it puts us in this negative cycle. And sometimes for some people, medication may be your option. You don't
Right.
want to do anything, but you don't want to feel the pain either. But there are some people, and like you said, pain is an indicator. It is not
Hmm.
just what Big Pharma taught us many years ago, is that pain is whatever the patient says it is. That was a marketing ploy for them to sell more opioids. Pain is
Right.
an indicator for you to stop and look where you are and where you want to go. What's next for Brandy? What's next for Glenay? Where am I?
Hmm.
What did my body trying to tell me?
Right.
So, Correct.
It is really important, and it's interesting. You talk about women, Black women. We all come from some place, and I think,
Mhm.
you know, we try to talk about it. I don't think we think really about how our backgrounds, cultures, personalities really feed into how we respond to life in general and work especially. And it's always interesting to me that when we learn these statistics, 80% of all autoimmune disease patients are women. These chronic illnesses are largely affecting women. We're disproportionately represented in so many various disabilities and illnesses. And also, women, not as much these days. I feel like we're learning better. And of course, different personality types. I always say I'm kind of a pushy broad sometimes. Not everybody's me, and thank goodness.
Right.
But we never want to really make too many. We don't want to be a burden on anybody.
Right. We don't
Oh,
like to make
don't let me be.
waves. Yeah.
Oh, I'm just not the person I used to be. I'm not able
Yeah.
to turn the patients like I'm supposed to. I don't
Yeah.
want to bother anybody. Let me just quit my job. And
Right.
so many of us, that's exactly what we do. Well, let me just quit my job.
Right.
When what we should be doing is staying there and
Yes.
saying, I need
Yes.
accommodations.
Yes.
I need help.
Yes.
Disability is not a lack of ability. What it
Right.
is it just means you need something else to enable you, allow you to perform the way everybody else does. With
Exactly.
visible illnesses, visible disabilities, that's easy, right? Oh,
It's
you're in a
easy.
wheelchair. We need to
Right.
make sure there's a ramp
Right.
so you
Right.
can get to work.
Right. But
That's,
with hidden
we get that.
disabilities, it's a little bit different.
That's
It's a big time
very
different.
different.
And
It's
it's funny.
trickier,
Hmm.
and nobody thinks obvious. Like, oh
Right.
gosh, I have Crohn's disease now, and
Right.
I'm sick usually early in the morning. How the heck
Right.
do I accommodate that? Well, we
Right.
can. We absolutely can accommodate your Crohn's
Right.
disease. It's about those. It's about standing up and saying, no, I'm still a very capable person. I just need an accommodation. We just
Right.
need to bridge that gap.
Right. We do need to bridge that gap. And it's funny you talk about the autoimmunity. I can remember when I was probably 9 or 10 years old and I first heard the word autoimmunity for the first time. And it scared me to my core. And I was like, why would your body turn against you?
Right.
It's just like, what kind of mess is this? So, when I was experiencing the issues I was going through at my workplace, had I told one physician about my markers, positive ANA, excruciating muscle pain, depression symptoms, the list went on and on. I would have definitely been diagnosed with systemic lupus and
Hmm.
autoimmunity. But my problem was fear,
Right.
overwhelming fear. Now, why would your body not turn against you if you're not going to put it first?
Hmm.
Why wouldn't it?
Right.
And we go, talking about medication as like the second employment health concern for women who are with chronic diseases and autoimmunity diseases and just trying to go to work. I quit taking just even Tylenol and ibuprofen to get through my day at work. Why? Because it's not benign. Even like I know a
Right.
patient who took two Tylenols, an extra strength Tylenol, 1,000 milligrams, sent her into an accidental overdose. This young lady had a headache and this young lady had menstrual cramps and she wanted to continue on with her day. And now she does nothing, absolutely nothing, because it damaged her to the point of no return. Taking ibuprofen for this chronic pain, they tell you all the time, it's for the muscle pain and everything. It tears your stomach lining up.
Terrible.
Yeah.
I mean, we love to joke. I was in the army, and let me tell you, we all love to joke about the ibuprofen because they'll prescribe you ibuprofen and water for anything, and they'll just up the milligram. Just give her 1,000. Oh, just
Yes.
1,600, and
Yes.
you're just taking ibuprofen for everything in
Right.
the army.
Right.
And once I was diagnosed with Crohn's disease, and I was told I had to stop ibuprofen. I said, "What? Wait, hold on. I've been taking.
Right. Did it cause it?
It,
Like, did it
I'm
cause
like, well,
it?
what did the ibuprofen do to me? Of
Right.
course, it did not cause my Crohn's disease, but you have to wonder how much it did to just make everything that's already so bad in my life worse.
Right.
And we just don't have those kinds of conversations. And I feel like
Right.
we always we're Americans, we love to do this. We head for the sides, or it's
Mhm.
all the way over here or all the way over here on the other side. And we speak in absolutes and extremes. And, that's not always true. For many people, you can take two Tylenol when you're having some menstrual cramps or a headache,
Right,
and it's fine.
right,
But what we never talk about are the side effects, the details, how
right,
much should you be taking?
right,
When should you stop taking
right,
this and start talking to a
right,
doctor? We
right.
don't talk about side effects,
Right. And understanding that side effects is not just a side effects. They are
Right.
organ damage. Like that's what it is. And how often are you going to take it into your body, reacclimates or, you know, damages? Like when's the stop point? When's the end point for this? Because I at the end of the day, when the rubber hits the mat, I and my family are the only ones that are going to have to deal with this injury from medication.
Because nobody's going to help you.
No,
I know that for
nobody's
darn
going to
sure
help you.
after going through it.
Yeah,
Everybody's, oh, what's the chances? Oh, you'll be fine. No, you just take the drugs the doctor tells you to. Well, now I went through drug induced lupus. I have a nervous system disease. I went through hell, and
right.
there was nobody to help me. And
Nobody.
what's so unfortunate is I always look back at it and say, well, thank goodness I had a lot of money in the bank. I
Right,
didn't have to worry for that. My
right,
husband makes plenty of money, so he was
right,
able to take care of the
right,
bills. And, but nobody should
right.
have to go through that. And we have to stop pretending that people who don't trust big pharma or the healthcare system or any of the politicians, the
Hmm.
CDC, are
Right,
just too stupid and
right,
make fun of them,
right,
because no, they've been wronged,
right,
and nobody was there to catch them.
right.
And if you're me, you have time to be mad and start a podcast. If you can't pay
Yes,
rent or buy groceries, well, you know, what are you doing? You're just
right,
mistrusting the entire system, and you don't
right,
want to deal with anybody now because you don't
right,
have time to do fancy podcasts or research the FDA and
right,
submit FOIA
right.
requests. You're trying to eat. You're,
Right.
you're
So,
trying to find a place to live.
Brandy, I want to interject you right there because I a widowed mom, two children, a homeowner, and this situation happened to me at a major U.S. hospital here in Los Angeles. I was 40 years old, and this was 2015. I was making $67 an hour with a $20,000 stipend, so I'm making almost 150,000 a year
Hmm.
as a young Black woman working as a transplant coordinator and a homeowner driving luxury vehicles. I did have put money up, 10% in my
Right.
403B and had pension. However, I still had to walk away not knowing how I was going to sustain my life. And my company, the organization I worked for, played corporate games, delaying paperwork, having me
Right.
lose my pension and having me lose these other things because it became more of a ego trip for this person and targeted racism disabling me and my children.
Hmm.
However, my children and I lived 6 months, I mean, sorry, with 6 months unemployment, a cashed out 403B, and I went 2 years and never missed a mortgage payment or a
Good for
flight
you.
out of town when I needed to.
Yeah.
No, I did not go and get my toes done and, live the
Right,
same
all the
way that
nice
I
stuff.
did.
Yeah.
Yeah, all those other things, but we continued to eat. I wrote my first book. Well
Hmm.
done. And and then after 2 years I was recruited by another hospital without ever having to go out and look for a job. So I literally stayed home and just rested and healed and wrote. So I believe that regardless of what what things you have in place in your life to catch you, that when you put yourself first, nature will take care of you. You will be rewarded for doing the right thing. And that has been my experience. And I think that's the hardest thing to try to conceptualize for other people, that the people who are suffering homelessness and unemployability, it's because they chose the system ways instead of saying, you know what? I'm not going to quit because you want me to quit. I'm going to continue and push through this systematic issue without any resistance because my rights are on the other end of this. And then I'm going to see what happens. But what happens is that I was protected from impoverishment and becoming homeless, and I healed. And I would like to continue to help other people um, replicate these results by trusting and using good faith in the workplace.
Yeah, knowing your rights, um, that's the best start.
Hmm.
Um, just standing up for yourself, knowing what you are entitled to. I just did an episode with an employment attorney, and he gave
Hmm.
great advice. Don't leave.
Don't leave. Don't quit.
Just stay. Don't you get
Right.
off those books. Just
No.
stay on them. Okay,
Yep.
fine. You don't have to pay me. I'll just unpaid leave while we fix this.
Yeah.
Let me go home and heal. But
Right.
don't get off those books.
Mm-mm.
Don't don't do
Mm-mm.
it. Just don't quit. And that's
Mm-mm.
what most of us immediately. That's what I did. I was like, oh
Hmm.
crap, I can't get to work. What should I do? I should probably just
Right.
quit.
Right.
And that's the wrong
It's the wrong
answer.
move. You never quit. You never close your own door. Now, lately, I've been hearing nurses, uh, judges giving nurses this stay at work order.
Hmm.
Situations like that, I probably would quit because that has nothing to do with my rights. You're
Right.
trying to force me to do something when I'm trying to exercise my rights. But if
Right.
something is your right, something is your workplace, state, federal, and healthcare right, those are things that you should be pursuing because that's where your health equity comes from.
Hmm.
No one is going to mandate me to go to work. Who paid my student loan? I'm sorry. Did I sign up? Is nursing a military branch? Like, I'm sorry, what's going on here? I
Right.
am an employee of these United States of America, and I have rights.
Yes, and of course, we need an entirely new show to focus on this, but um, you know, we got to start a new episode. But employment rights and treating employees fairly and justly, that
Right.
goes a long way. I started my career in the Army, and everybody talks about how they love hiring former military, especially military officers, because of our leadership experience and
Right.
how we know how to go in and lead a group of people and get that kind of buy in for the overall mission. Yeah, but you know what? I can tell you for certain after being an Army leader and a leader in the civilian community, those are two very different things.
Hmm.
And so much of what we do is focused on taking care of the troops, taking care of the people that you have been appointed charge of. That's your job. You make sure to
Right.
take care of them. And it's just not the same. And when you look at a field like nursing that's so under shortage, and
Right. It's a
we're
life
losing
support.
nurses
Hmm.
and doctors.
Hmm.
This is a real problem. This is a
Hmm.
crisis. This is
It's
a
a crisis.
crisis.
It
We
is.
should have declared a state of emergency in healthcare a long time ago.
Yeah, way
It's
before COVID.
overdue time. Overdue
Brandy,
time.
thank you for your service in the Army. And it's for nurses dealing with this leadership. I had this novel idea about the leadership in healthcare, moving it away from nurse managers because they're in a precarious situation where they have to do what's best for the stakeholders and then they have to manage the employees. They do all of this leadership training, but maybe your manager is not a person who is a born leader or have empathy that they can tap
Yes.
into. So I feel that nurses, that they should take some of them millions of dollars of consultancy training and put it towards providing the nurse with the tools that they need to do their job, practice safely, and become
Yes.
fearless in the face of potential retaliation, knowing that you are the foundation and the heart and soul of healthcare. So, what are you
Yes.
afraid of? Like, what are you
We
afraid
need
of?
to center we need to center our healthcare around nurses and health practitioners in general. Doctors are
Mhm.
suffering as well.
Yes.
I think a lot of people, they turn on the TV. One of my favorite shows is Botched. Watch that on loop at all
Mhm.
times. But they're not all plastic surgeons
Right.
making millions and millions of dollars
Right.
and building new, $40 million homes on the Real Housewives.
Right.
Most of these
Right.
people are overworked,
Right.
stressed, doing their best,
Right.
and just really collapsing under a system that's just not designed to focus on the health. And look, I have an MBA too, I mean, I know shareholder wealth, yada, yada,
Right.
yada.
Right. Right. Right.
But at some point, we have to admit when things are failing.
Mhm.
And if we want to keep nurses,
Right.
you know, we need to do something different if we want to, retain doctors.
Right.
Same.
I'm
And
trying to
what's
wonder.
crazy is it all exists. Go talk to the army.
Right.
Go talk to the Army, ask
Right.
them what they're doing. You know what? Talk to the Navy.
Right.
When I'm sick, you know where I go? I live on the other side. I live on in Old Town Alexandria. That is on, right across the bridge, from the other side of DC as Bethesda, where the Walter Reed Hospital is. But every time, unless it's a severe emergency, I tell my husband, Steve, put me in the car and drive me to Walter Reed. Why? They have the Navy people there.
Right.
I'm here to tell you, if I'm dying, I should say, and if somebody says, hey, I'm a Navy medic, I'm a Navy corpsman, you better bring that person over to me because they know exactly what they're doing.
Right.
Navy and healthcare, call those guys.
Exactly.
Ask them what they're doing in
Exactly.
training. Call them.
Exactly.
I guarantee you, we're going to get somewhere.
Exactly. Yeah, my
But
colleagues are
anyway,
suffering. They're suffering within the
yeah,
walls of the healthcare industry, whether they're doctors, anesthesiologists, they are known for committing suicide. I
yes,
don't know if it's a combination of, well, I do know sometimes it's a combination of these astronomical student loan,
oh yeah,
and then you get into healthcare and it's like, what is this? Like,
hmm,
this is not what I signed up for. It's
right,
totally different, and it has almost no humanity. You bring the humanity into it yourself, but then
right.
and they snuff it out of you very quickly because it's like, huh?
It's
It's a
you know
lot.
what It's a lot. You know what? And I always say, I do not want my ER nurse or doctor to also be an expert in billing and coding.
Right,
I don't. Stop.
right.
We have to do something. And the
Yeah.
fact that they're required to do so much, the fact that, I still have anger towards my GI for not recognizing my reaction, which, by the way, is pretty fairly common. But
Mhm.
also, where does he have time to, read all the latest stuff coming out of NIH and the FDA when he's owned by, and this is true, the GI
Right.
practice I went to, much like over half of all of them in the United States, was owned by a large chain. And he
Mhm.
has quotas he has to meet. There's
Right.
quotas. Your doctor
Right.
has a quota. He has to
Right.
see so many patients each day. He has to do so many
Right.
procedures.
Right.
Where did he have time? Of course, I,
Patients are
had a
just a medical
terrible
record
reaction.
number.
Yeah.
They're just a number, and they are part of a huge billing system. And it's disheartening to hear, but I think more patients need to hear it and get
Yes.
themselves educated before going into the healthcare industry and know what they want. And like, I offer health equity plans. Like, you need to know what you're going in for and not just be sold when you get there.
You're right. Yeah. No, you're right. We need to think about all of these things. It starts with improving our healthcare system and,
Hmm.
you know, valuing
Hmm.
our healthcare providers. And it
Right.
also we've your work is amazing because we need people to understand what they need to do to stay employed, what they need to
Hmm.
do to get those accommodations,
Right.
understand their rights.
Right. Right.
Uh, we're doing better, but there's still so much work that needs to be done. If I
There
say
is.
FMLA to people, most people say, "What's that?"
Oh, I didn't realize that. People just don't
Hmm.
even know what it is. And I think that
Hmm.
people who do know what it is using it completely wrong. They use
But
it to
yeah,
just kind of do a day off or here and there. And maybe if
well,
that works
which
for them, that's fine. But if
that
you're
might be what
absolutely
they need.
yes, if you're absolutely having an issue that you're trying to avoid, you need to use that time so that you can properly address that issue.
Yes. And taking care of yourself is super important. None of us
Oh,
do it right.
definitely.
None of us.
None of us do it right. I lay in bed sometime and I'm like, what's wrong with me? And I'm like, girl, you are a burnout, career burnout recovery and rest. Like that's what you do.
Yes.
Why are you mad about
Sleep.
being in bed?
Yeah. Sleep. That
Exactly.
nobody says that enough. You feel you're lazy, you're like, "Oh gosh, I gotta get out of bed."
Yes.
I've been going through a severe illness for 3 years now, and the one thing I do hear from doctors relatively frequently is, "But why don't you just sleep?" Like,
Right. Right.
you
Because
you
sometimes
really
it's
do need
hard.
to recover. Your
You
body
do.
needs
Hmm.
the sleep. Just sleep.
Right.
And I think, "Well, is it really that normal?" But I'm not normal right now.
Right.
I
Right.
you know, I can't be that person. It's fine.
Yeah.
It's fine.
Well, that's exactly what it takes to recover is rest because, I just wrote a blog, Rest is Resistance. And so you definitely need to learn how to rest because when you're given the time we heal. We heal.
Mhm.
If you quit doing implementations with this medication, this diagnosis, this, and this. Given the time, stopping whatever it is that caused the repetitive injury that left you where you are in that position, we will heal. And, this is why it's important to know what your job and your role functions are, to know your rights, and to fearlessly pursue them without
Mhm.
reservation. Um, and to look for the help on the outside of your company, on the outside of pulling out your employer sponsored health insurance card, because those are your employer's allies. You need
Mhm.
your own ally. You need someone who's going to be third party and biased for you and your health
Right.
outcomes, period. Yes.
That is the truth.
Yes.
And, we just need to do better on all levels. That's, you know, I love the work you're doing. That's why I started doing a lot of advocacy work, especially in the workplace. There's so many options that we're just not being given.
Mhm.
It's
Yeah.
either don't work or, you know, burnout or,
Right.
it seems like
Right.
we're always heading towards one of those sides of the extremes.
Right.
But, as an RN, now, I absolutely need the RNs everywhere in my life. You and I had a good conversation before about
Yeah.
how we need the kinds of RNs that are going to stand up and say no,
Yes.
because
Yes.
that's what keeps us alive. That's what keeps
Yes.
medical errors from happening. You need somebody in the
Yes.
room to say, "Doc, stop.
Right.
Let's take a look at this." And that's
Exactly.
really important. But there's also other roles that we could use RNs. I'm very I live in DC, so everybody would think that I love having, myself surrounded with 7,000 attorneys at every single job that is seemingly completely unrelated to being an attorney. But you know what? I am just sick to death of going to various policy meetings or, you know, name the advocacy center or whatever it is. And I'm surrounded by people with masters in public health or healthcare policy and a JD.
Right.
Where's the RN? Get
Right.
me the
Right.
RN
Well, I would
who is
love to
having
insert myself into that.
issues. Yes, well, we need you. Get,
I would love
these
to.
lawyers, stop
Yes.
hiring lawyers.
Stop hiring
HR,
lawyers. Yeah.
get it together.
Right.
Where's the RN?
Right.
Where's the doctor that's having burnout? Imagine
Right.
if you could rotate your nurses who are just experiencing extreme burnout for good reason
Right.
and put them in a position where they're just looking at policy.
Right. You're absolutely
I
right.
need that.
Everybody wants to hire an employment attorney. I mean, I've had an employment attorney. I even had consulted with an employment attorney that I had many years ago for a harassment issue that I had in the workplace. But this case that I had at this hospital that I worked at was just a little bit different. It was just a little bit different. And I think
Mm,
because the exposure was just a little bit different and it was just too big to try to
mhm,
deal with in mediation, right?
right.
It was more important, more valuable for other people than just me getting a compensation. And so I people hire attorneys, our employees like, oh, they're so quick to want to sue you, sue their employers or try to. Good luck if you find an employment attorney, number
Right.
one. And number two, wants to take your case. Or number two is that when you do, good luck recovering from it, because you will
Right.
be beat down to the pulp
Yes, you
of
will.
who you are, and you will question your own breath that you take next. Like,
Yeah.
and you people don't know this. And so part of my work is also doing this informed consent, not just for healthcare, but informed
Mhm.
consent for legal. Because
Right.
while discrimination in the workplace is unlawful and illegal, it's still business at the end of the day for
Yes.
all of them. And no one
Yes.
is concerned about your health equity, but I am.
Mhm.
I'm concerned about your health equity, and I want people to make the best decision for them, the best informed decision, and not
That's
just
what's
look at the
important.
money, not just look at the compensation that you receive from it, because it's pennies. Like,
Right.
sometimes the lawsuits are not worth the paper that is printed on. Come on, like,
Right.
a lot. And so I think, and then you're in shambles because you're like, oh my God, like they never even admitted to guilt. And here I am with this money, this dirty, dirty money. What am I going to do with it? And it just blows in the wind.
Yeah. Nope, that's great advice. So,
Yeah.
and before we go, where can we buy your book?
Okay, so, my books, I just want to say that people who believe that their lives matter more than a corporation's bottom line, who desire freedom from fear, will get my books. They will do the work and they will pivot. They will profit and they will claim their health equity, their worth, and the value of living the life they were promised. These books are available only at Glennae's RX for Life. I wanted to make sure that I stay connected to all of my readers. These books are a movement forward, they're a method, they're a model, and they are literary insights and geniuses because I can write my butt off. so,
Mhm.
so not only are they a good read, if you don't need my services, ebooks are available, but our print books are only available for a bundle if you need my services because other good things come along with it. So Glennae's RX for Life book bundle, and you can you can sign up to get on my calendar to do a discovery call where we do an intake and examination and give you a nursing diagnosis and move forward with your prescription for life, because child, so many people need it.
Yes, we do.
Yes.
That is the truth, and I'll be sure to put that, in the show notes as well for
Thank
everybody so they could
you.
easily find it. But thank you so much for coming to talk. I mean, we could probably talk forever and ever about this. I think we could probably push out 7 or 8 different episodes around these topics because we need to do better. Burnout is so important. People are, going through burnout even if you're completely healthy.
Right.
So, these things are very important to be talking about. So, thank you so much for coming on and sharing your perspective and your story.
Thank you, Brandy Schantz. It was good talking to you.
You too. That's a wrap for this episode of Living Chronic. I hope today's conversation gave you insight, inspiration, or at least a little reassurance that you're not alone on this journey. Living with a chronic illness or disability comes with its challenges, but it also comes with strength, resilience, and a community that understands. If you enjoyed today's episode, be sure to subscribe, leave a review, and share it with someone who might need to hear it. You could follow me on Instagram at Chronically Brandy Schantz, other socials at Brandy Schantz, or my website at brandyschantz.com for more discussions, advocacy updates, and everyday strategies for thriving with a chronic illness. And if you have a topic you'd like to hear about, send me a message. I'd love to hear from you. Until next time, keep pushing forward, keep advocating for yourself, and remember, you are more than your diagnosis. You are powerful, you are unstoppable. Thanks for listening to Living Chronic. See you next time.